This week, you will be reviewing learning disabilities as well as intelligent testing. So what we are really going to focus on is the WAIS and the WISC. So Rechler's intelligent testing for adults as well as children. So WAIS is for adults and WISC is for children. I wanted to give you some additional information on when these tests may be used and how they are applicable in clinical settings as therapists. So likely if you do pursue working with kids, especially in a school setting, you're likely to come across a lot of reports with WISCs for certain clients, especially if they have an IEP. Again, the most important thing is just so you know the differences, I just want to give you some practical examples. So students that are maybe testing for learning disabilities and things like that. And for an adult, you might see this with maybe someone who's having a difficult time in a work setting, or maybe they're working with a therapist and they have some cognitive deficits, or someone with traumatic brain injury, TBI. So say someone was involved in an accident of some sort. They may provide this type of test to see where their current levels are at. You'll learn all about what comes within the test in the reading and as well as in my PowerPoints that I provided. There are also a lot of examples that are really good to keep on hand. You never know when you're going to come across this information. So a lot of times if you're working with clients, even if you're in an outpatient setting, so say you're working with children, and parent tells you that they did psychological testing at school, you have the right to, as long as you get a release of information signed, you could access that report if you get in touch with a school psychologist. So for your presentation this week, just to further clarify, I'm just asking for a 12-slide PowerPoint presentation at a minimum. It could be more, but 12 at a minimum on the WAIS. So we're going to do adults here. And I want you to provide me with a history and the development of WAIS, which you could find in your book. There's a whole section on it. I believe the chapter starts on page 139, as well as the strengths and limitations. So we know that with all tests, all come with strengths and all come with their limitations. So I want to know what the WAIS's strengths and limitations are, as well as the intended use. So when do we tend to use these types of tests in a clinical setting? So I gave you a few examples, and you are welcome to come up with your own examples. In fact, that's what I want to see. So that, providing you some hypothetical clinical examples of cases that might warrant a referral for cognitive assessment. So if you give me 2 examples, I know that this feels maybe tricky when instructions are too vague or ambiguous because we like structure, but I just want to know that you understand where these tests are relevant and how might they be applicable in a clinical setting. And in these hypothetical clinical cases that you're providing me, I want to hear the factors that you might encounter that would necessitate a referral for testing, as well as your personal reflections. So I want to know how getting the results of these tests may enhance your clinical work with them. So how might knowing this information be beneficial for their treatment plan? And 3 academic references, and you could use your book as one of them. I'm fine with that. I want APA formatting. So with in-text citations, especially if you quote, make sure you use your APA in-text citation formatting, and there has to be a reference slide that is not a part of the 12 slides. So it's total, I guess, going to be 13. And then that is it. So it's pretty straightforward. I think the trickiest part might be coming up with the clinical case examples, but just get creative and really envision you working with a client and ask yourself, okay, how would this information benefit me in my treatment plan? Okay, so I am looking forward to reviewing your work. please contact me with any questions or concerns. I'm here to clear anything up. You have all the information you need in this section, as well as your book, to understand the importance of the WAIS and the WISC, as well as different learning disabilities.